First order of business is a bill introduced by Mr. Brady and Mr. McDermott to protect the Integrity of Medicare Act of 2015. Mr. Brady, you are now recognized for an opening statement on your bill.
Thank you, Mr. Chairman. I couldn't agree more with your opening statement. You've made it a priority to see the committee proceed through regular order on good health care legislation, and to do it in such a bipartisan fashion. That's what our constituents set us here to do. Over the last year, Ways and Means staff from both parties have worked together to get us to this point on the Protecting the Integrity of Medicare Act, or PIMA, as we call it. I want to thank all of my fellow members, both sides of the aisle, who have made this effort a priority and have worked with us to craft legislation that includes over 10 member priorities. I want to thank the stakeholders who over the last year have taken the time to weigh in, providing constructive feedback to improve the bill. And this bill will help to preserve Medicare for our seniors and reduce the rampant fraud, waste, and abuse that continues today. This is an important step, but is not the last step. There are many other great ideas out there, and I hope that we'll all continue to work together on these efforts. Along with the other important policies in the bill, it's great to see a decade-long priority move forward for my fellow Texans, Sam Johnson and Lloyd Doggett, whose provision would protect seniors from identity theft by removing Social Security numbers from Medicare cards. The Centers for Medicare and Medicaid Services has identified also a small population within Medicare that is purposefully abusing or diverting drugs through pharmacy and doctor shopping. I've witnessed this problem firsthand with the pill mills in my communities, and I, for one, believe we need to put a stop to it. For this reason, I've included provision in PIMA that would give plans and the agency another tool, a tool that's already available in Medicaid and private insurance, to combat this behavior that is costing the Medicare program dollars and ultimately harming seniors. The negotiated language is good policy and will get to the heart of the problem while guaranteeing beneficiaries the access to medicines that they need and rightfully deserve. The policy has even made its way for the first time into the President's budget and has garnered the support of many stakeholders, which I would like to ask unanimous consent to submit those letters of support for the record, Chairman.
Without objection.
And I've said it before, I'll say it again, every dollar lost to Medicare fraud is a dollar stolen from America's seniors. And every dollar lost to improper payments, intentional or not, robs from the solvency of this important program. Sad part is this past year, improper payments actually went up from the year before. This is the time to act in educating our providers as well as the contractors that pay and audit them. We have to find ways to rein in the bad actors while getting out of the way of the providers that follow the rules and provide quality care to our seniors. Action on PIMA, I hope, will also prompt the Centers for Medicare and Medicaid Services to take on a stronger leadership role in reducing fraud, waste, and abuse. For years, we have just arbitrarily funded attempts to fix these issues. So finally, I'm happy to say we have introduced policies that reduce fraud, waste, and abuse that are paying for policies to reduce fraud, waste, and abuse. While we may not always agree when it comes to health care and its delivery, I hope that this is the start to finding solutions we can agree upon and legislate. I thank you again to my fellow members for their work, GAO and OIG for their sustained effort, and the stakeholders for their input. And with that, Mr. Chairman, with that, I yield back.